Thank you again to Joana Vizcarra and the dancers from Samba Conmigo. Excellent performance. More on Brazil coming up soon, but now let's go learn more about Gardner Family Health Network with CEO Raymundo Espinosa. Raymundo Espinosa, Chief Executive Officer of Gardner Health Services.
Yes.
Thank you very much for being here with us, Raymundo.
Thank you for having us.
We appreciate your time. So before we get started, can you share with us a little bit about yourself and kind of your trajectory in becoming the CEO of one of Santa Clara County's nonprofits, largest nonprofits providing health services?
Sure. I was raised in the Coachella Valley, in the town of Coachella. I was the son of a farm worker, but by the time I came around, he had found a more steady job in a packing shed. And so it was I thought it was a challenging, but in a way a good life, but many tragedies in my family. Many of my siblings died by the young, 20, 28, 34, 61. My dad at 65, and so I think that kind of like was, especially when my sister died at 20, was kind of like the thing that pushed me into healthcare, into trying to succeed in that arena. I went to school 18 years in Coachella, and then came up here to Stanford University, and I received my BA in political science, and then I got my master's in public health hospital administration, specialty at UC Berkeley.
Great.
Yeah.
And how long have you been the CEO at Gardner Health Services?
Since 1986. I don't know how many years that is.
Dedicated quite a number of a number of decades there, but it's a great organization to be working for.
Absolutely.
Share with us what are some of the key services that Gardner Health Services provides in the community.
Well, first of all, we see about 60,000 people. We have what we call primary care, which is medical, dental, optometry, pharmacy, and then behavioral health, which is mental health, substance abuse. And then we have a WIC program, which is it's Women, Infant, and Children's program, which is a food supplement health education program for low-income women.
Is that program available to anyone?
Yes, that qualifies. There are income guidelines. I think you have to be 185% of poverty, which is really low. In fact, about 90% of our 60,000 people are at 200% of poverty. That means a family of four making 45,000. I would say 60% are half of that. So 60% are at making 24,500.
24,500
for a family of four.
Okay.
And in order to qualify for Medi-Cal, you have to be at 100% of poverty, which is that 24,500 family of four. But I'd say 78% are Latino, and then we have, of course, about 8% white, and I think about 6% Asian Pacific Islanders, and then the rest are African American. But predominantly, we have like 10 sites. 7 are health centers. We provide services from Gilroy to Palo Alto. The majority of the services are either in the downtown East Side area
of San
Jose, and so, like I said, we provide a lot of service to folks who really need it.
What type of services, like medical services, does
well, we help the whole
provide?
range. It's mostly what they call outpatient, which is ambulatory. We try to prevent stuff, so we give immunizations. But there's also other things. If you have colds, flus, those types of things, we have a large dental program. We have optometry services. Like I said, we have a healthcare to the homeless program. We have, I think, go to about 10 different shelters and provide healthcare services to the homeless population.
Do people have to have their own private insurance, health insurance?
We take, that's one of the issues for us, is that we take people regardless of the ability to pay. We welcome their insurance, but if you look on the medical side, because we have 2 corporations, this is more general, but in our medical program, I'd say out of the 35,000 individuals that we see, maybe 18,000 are without insurance, which is challenging for us because we get about a quarter on the dollar. So a lot of our effort is to try to.
Who gives that quarter of the dollar?
We through
government grants.
Government grants, county grants. The biggest supporters, of course, have been the feds and the county. They really support us to a large degree as far as the uninsured. And many of our programs, in fact, and we have a large mental health program that deals with the elderly, kids, people coming out of prison to get them back into the community. We've had a Cambodian program that's, in my opinion, unique in that we work with them on the post-traumatic stress syndrome issues, and work at the temples and try to get people to have a better life. And I think that's our philosophy. It's not about healthcare necessarily. It is, but it is, and it's a means. So I think for us, it's more of a keeping people healthy, mind and body, so that they can hopefully achieve their dreams. And I think that's what our focus is.
I understand that you have a mobile clinic that travels throughout the community to provide services. Can you share a little bit about that?
Of course. So like I said, we have different sites. Many are here in the downtown area, but we do go to Palo Alto once in a while, and we do go to Gilroy and some of the labor camps, and it's a mix of patients. But what we try to do is provide services out there and then refer them to our clinics if they need further help. But we try to go out there to hopefully get access, because I think some people are apprehensive about
seeking medical help.
Seeking medical help.
So you at the mobile clinics, you provide kind of basic
it's what they call
education services?
It's like services that you may need that you haven't gone to. If we find something more urgent, we work with the county to get you more specialized care if you need it.
Do you accept now that the Affordable Health Care Act is going to be online? You take those insurance providers?
Yes, we do. We have a contract with Valley Health Plan at Santa Clara County to provide services to those who may qualify. The other benefit is that the Affordable Care Act also increased the number of people that could become eligible for Medi-Cal. Before the Affordable Care Act, Medi-Cal was mostly for women and children. The Affordable Care Act increased the income levels, so they went from 100% of poverty to 133, and then they're targeting the adults now to a greater degree, and that's helped us to some degree because the Medi-Cal helps us. They're our best payer. Most people don't necessarily want to see the Medi-Cal, but we do, because they're our best payer. The challenge is that we have so many still remaining uninsured that are not covered by the Affordable Care Act, that we still have to make the effort to find other funding to continue to provide the service. The issue, for many people, it's the staggering statistic is that there's 440,000 individuals in Santa Clara County that are 200% of poverty and below. And people don't understand that, but that's a quarter of the population that are at, like I said, a family of four making 45,000, and so there is a big need, and they have to make choices. So many times, even when we still see the uninsured, our docs work and say, well, can you come in this week, or do you need to pay something? Do you need to get your medicine, or do you need to pay rent? Can you afford the transportation? So it's a challenging situation for many of the folks out there.
Raymundo, thank you very much for coming on to our show and sharing about your organization. Very valuable information, especially for some of our viewers who may be interested in seeking some of your services. Thank you very much.
Thank you. Appreciate it. Thanks.